Yeah.
Great.
Okay, so my name is Ellis.
I'm Sabrina Deese.
I'm Chastity Mathis.
And I'm Ryman, and we'll be doing a presentation on forensic nursing. And the brief history of forensic nursing, it has its roots in the 18th century when midwives testified in court on behalf of matters such as pregnancy, rape, and virginity. It evolved from the police surgeon and forensic medical examiner in the United Kingdom, and physicians and nurses ignored the forensic issues of living, while the medical examiners and coroners did not associate with the living forensic patients. Forensic pathologists strongly believe that if legal questions were not addressed during the care of the living patient, justice will suffer, the innocent will be criminalized, and the criminals would go free. And by 1980, U.S. physicians and forensic pathologists realized the inadequacies and the need for building an effective partnership between the health and justice system. And in 1993, Dr. William Smock and Dr. George Nichols II of the University of Louisville, Kentucky established the first clinical forensic medicine program. In 1986, the University of Texas at Arlington implemented the first formal degree in forensic nursing, and in spite of initial resistance from the medical and legal communities, forensic nursing has become the moving force in clinical forensic practice in the U.S. and Canada.
So what is forensic nursing exactly? This is basically the scope of practice and things that they specialize in. A forensic nurse is a registered nurse who provides specialized care for patients who are victims of or perpetrators of any kind of crime or event that involves bodily harm or trauma. They have specialized knowledge of the legal system as well as additional training in areas of collecting evidence, injury evaluation, identification, and documentation. First and foremost, they are a registered nurse, so they will tend to the patient's immediate medical needs first. Following that, then they will collect evidence such as bodily fluids, tissues, hairs, and then a lot of times they photograph the patients, things that they can use later on in court, and like their injuries and things like that. After they're done with the patient care, a lot of times they end up speaking with the legal authorities about the situation, as well as oftentimes provide medical testimony in court based on what they found with that patient. There's lots of different areas that forensic nurses are used. The main one, and really the one that a lot of forensic nurses get into that field, is the sexual assault nurse examiner. They have to take a SANE examination, and they get certified in that. Basically, whenever a patient comes into the hospital and they are a victim of sexual assault, they would call a nurse in that is certified with the SANE certification, and they come in and properly care for that patient and evaluate the patient. From there, they also specialize in situations involving domestic abuse, child abuse, elderly mistreatment, death investigation, and corrections.
If they are already a registered nurse, they must certify in forensic nursing through a forensic nursing certification board, such as the American College of Forensic Examiners Institute. They have to have 40 credit hours in sexual assault coursework. They're required to take an examination, and they must already have 5 years of nursing experience. If they are going to be a sexual assault nurse examiner, they must already be an RN and take the same certification test. There's one for adolescents and adults and the other one for pediatrics. They can take both. And they have to recertify every 3 years. There's a master's in forensic nursing, a PhD in forensic nursing, and they also have to complete an examination and do clinical hours and apprenticeship. The working environment, they're usually employed by health regions, medical examiners, offices, hospitals, or they could be self-employed. It's very fast-paced, highly structured, and research-oriented, and the person must be both compassionate and highly analytical. They may need to testify in court as an expert medical witness, and they work kind of strange hours, they're usually on call. And the job isn't for everyone, as forensic nurses have to deal with trauma and death resulting from abuse, violence, criminal activity, and accidents. And victims are often women and vulnerable people such as children or the elderly, and there are no physical requirements.
For the pay opportunities, the mean salary for the first quarter of 2015 was $78,238, which varies from state to state. It depends on the demand in the area, state, or county. The projected job growth from the year 2012 to the year of 2022 is 12%. Having a SANE or sexual assault nurse examiner certification typically means you make 1.5 times more than the normal RN hourly rate while performing forensic nursing job duties. Typically, a forensic nurse will make $1 to $4 more an hour than a practicing registered nurse. Are there any questions?
You know, thank you for giving a presentation. I knew about forensic nursing, but I never really considered like the SANE and the domestic abuse investigators as forensic nursing. That's pretty interesting. Do you know, are there people who are specifically employed as forensic nurses, as like SANE nurses? My experience has always been that it was like an additional duty.
Yeah, it's an additional duty. It's a registered nurse who may opt to get that certification, and they work their normal hours at the hospital. If a patient comes in and they're a victim of a sexual assault, they will call on that particular nurse to come in and handle the situation. They also are on call with like the police station and the hospital, so at the middle of the night, someone comes in that's a victim of maybe sexual assault, they'll call that nurse in to come in because they're the ones who have the specialized training in how to evaluate the patient and get the correct, what's the word I'm looking for? Evidence. Evaluation of evidence. Yeah.
One thing that we're starting to see now is we're starting to see, because of the fact of nurse practitioners becoming doctorates and master's programs being phased out, a lot of the SANE nurses now, or the push towards the SANE nurse, is to allow a DNP or a nurse practitioner who, or someone who just specializes in a master's degree or greater, in some states to start their own practice and contract out those services with police officers and DAs and things of this nature. We have an excellent program at Knoxville, Tennessee, at University of Tennessee. Mitzi Davis is a well-known forensic nurse who started forensic nursing very early on. And she is at UT Knoxville. She's an FNP. And one of the things that she does is they actually contract through the College of Nursing to provide these services. One of the things that you didn't talk about that I'm sure would be very difficult to try to find the ratio between men and women who are employed as forensic nurses and SANE nurses as well. You know, we're seeing more and more violence to occur, especially when you look at gender dysphoria that occurs, the transgenders that we're talking about now, and things of this nature. And so, being a very good communicator, being non-judgmental, having those real good basic psychiatric mental health communication skills is really, really important as well.
Yeah.
You're going to see things yourself as a nurse that will flabbergast you, you know, to no extreme. You know, so it's how can you handle those things as well when you think about this as a career. We're also seeing an increase now in the amount of pay because of finally people are better educated and they're coming forth and they seek, rather than being shunned by the court systems, now we're finally starting to see that there's less shunning that occurs because you come forward. And so there is an increase in the amount of people who are reporting the crimes now. But the major thing is getting the evidence to be able to win the court case on behalf of that person, whether it be male, female, child, elderly, whatever. So it's an up and coming field, you know, if you have an interest in that type of thing. A lot of people, CSI, we actually have talked here and have been working with the forensic people here, or not forensic people, the program we have here.
Criminal justice.
Yeah. In regards to maybe offering later on a postgraduate certificate in forensic nursing here for people that might have an interest, because there is a great need, and those services are out there, or the need for those services are out there. Good, you did a good job.
Thank you. Before you go too far, I need to get your names again.
Oh.
Oh, we had a yes too.
There's a record.
It's not ready.
I was like, yeah, this is something, and I was on to John, and it's like, dang.
You get the slides and everything.
Yeah, I was on, I drove halfway, like, and then you texted me.
She was supposed to.
It's okay. Yeah, you're right. I'm sorry. We were gonna wing it. We were gonna wing it without the slides.
I was like, oh.